Polycystic Ovarian Syndrome, or PCOS, is a common condition affecting female fertility and is the most prevalent hormonal disorder. It's thought to affect between 6 and 9% of women, but its exact cause remains unknown. Doctors will diagnose PCOS using the Rotterdam Criteria, which means having at least 2 out of 3 signs. Number 1, irregular or absent ovulation. Number 2, excess male hormones. And number 3, multiple tiny cysts on the ovaries, which are seen on the ultrasound scans. I have unfortunately seen many women labelled as having PCOS just because of the ultrasound appearance alone, and this is a big mistake, as around 20% of women will have polycystic looking ovaries, the majority of whom will not have PCOS and it will not affect them in any way at all. The symptoms of PCOS will vary, but often include obesity affecting 40 to 50% of all patients, excessive hair growth especially on the face, acne, irregular periods, and trouble getting pregnant. PCOS is also linked to high levels of insulin, and insulin resistance is in about 60 to 70% of women with PCOS. This can lead to metabolic problems like high cholesterol, diabetes, and heart disease. Treatment for PCOS usually starts with lifestyle changes, such as diet and exercise. For women who are trying to get pregnant, treatment can also include medication, such as metformin to help the insulin resistance, drugs to induce ovulation, and IVF treatment. There is also surgery called ovarian drilling, but it's risky and not commonly recommended. There are extremely few situations where I may suggest this option to a patient. The most common fertility issue in PCOS is a lack of ovulation or delayed ovulation. The first-line treatment for this is ovulation induction, where medication will stimulate the ovaries to produce follicles. This treatment is simpler and cheaper than IVF, with a success rate of about 50 to 60% over 6 cycles. There is a risk of multiple pregnancy with this, therefore monitoring is crucial, with ultrasound and blood tests so the cycle may be cancelled if the risk is too high. For women with PCOS, pregnancy can come with additional risks like miscarriage, gestational diabetes, high blood pressure, preterm birth, and larger than average babies. Long-term, PCOS can increase the risk of type 2 diabetes, sleep apnea, heart disease, high blood pressure, and endometrial cancer. If you or someone that you know has PCOS and infrequent periods lasting longer than 3 months, it's recommended to see a doctor to induce a period. Prolonged exposure to estrogen without progesterone increases the risk of endometrial cancer, and this is an important point that is often overlooked.